JOHESU was called off its 7-day nationwide warning strike, urging members to resume work today. The joint health sector unions and Assembly of Healthcare Professionals suspended the strike after the federal government's delays in addressing welfare issues. The union's demands include implementing a consolidated health salary structure, reviewing June to December 2023 arrears by 25%, raising retirement age for health workers, tax waivers on allowances and immediate payment of COVID-19 hazard allowances. In a statement on Thursday signed by leaders Kabiru, Minjibir and Martin Egbanubi, JOHESU gave the government 6 weeks to meet all Memorandum of Understanding obligations or face an indefinite strike. JOHESU plans to review progress in an emergency NEC meeting at the deadline. To discuss this, we're joined by Comrade Martin Egbanubi, who is the National Secretary, Joint Health Sector Unions. We're actually talking health, not education. Thank you so much, Mr. Martin, for joining us.
Thank you for having me.
So how significant is the consolidated health salary structure to JOHESU members? It's one of your demands. And what impact would that, looking at the implementation, what would it have on healthcare workers and the system as a whole?
Well, thank you so much. Like you have seen in our demands to federal government, the flagship of the demand is the implementation of the adjusted consolidated health salary structure. And this salary structure is so significant to our members who constitute the larger percentage of the workforce in the health sector. Significantly, we have about 80% of the health workforce who are health professionals and health workers that constitute the Joint Health Sector Union. The 4 registered union is the Medical and Health Workers Union, the Nigerian Union of Allied Professionals, the Senior Staff Association of University, Teaching Hospital, Research Institution and other associate institutions, and the Non-Academic Staff Union. Okay, so why this salary structure adjustment is so important and so germane to our struggle is that the 2009 agreements that constituted the 2 salary structure based on the collective bargaining agreement had a clause of adjustment of the 2 salaries simultaneously, that whenever one is adjusted, the other should be adjusted accordingly. So, but in 2014, there was an adjustment on one of the salary structure, which is the salary structure that caters for the salaries of the medical practitioners, the medical doctors, okay, which we call the consolidated medical salary structure. And there was no adjustment on the consolidated health salary structure, which caters for other health professionals and health workers within the health sector. So the agitation has been on since 2014, and it is about the welfare of health workers under the Joint Health Sector Union. It is about remuneration justice as established by the collective bargaining agreement, because it's so clear about it in the extant labor laws and even in the international labor standard. And these are completely established by different standards of the International Labour Organization with respect to remuneration.
Okay, so Martin, yeah, we understand. So Martin, now JOHESU has called off the strike. What actually influenced or informs that decision? And if the federal government fails to implement or meet your demands at the expiration of 6 weeks, what happens next?
Well, thank you so much. Well, what informed this suspension of this 7-day warning strike is the conciliation meeting that took place at the instance of the Federal Ministry of Labour and Employment. This conciliation meeting took place on the 29th of October 2024. That is Tuesday this week. And it is the meeting that has the responsibility as mandated by law based on the function of the Federal Ministry of Labour as to how trade disputes can be addressed in this country. So the Federal Ministry of Labour standing in for the federal government, led the federal government delegation into this conciliation meeting. And this conciliation meeting came up with a memorandum of understanding. And timelines were set to various demands as contained in the JOHESU Declaration of Strike Action. And so this MOU formed the basis for us to return back to the expanded National Executive Council of our organs, that is of the Joint Health Sector Union, and to review some of the things our federal government has promised to do within the timelines as contained in the MOU with respect to our demands. And of course, we look at it and we say, okay, we're going to give federal government an opportunity to address this demand within the window of 6 weeks. So NEC in session resolved that 6 weeks will be given to federal government to address some of these concerns based on their obligations in the Memorandum of Understanding.
Okay.
And of course, JOHESU also based on the premise of the public perception, of the public feelings of our own intervention that we can do to address the gaps that may exist in a situation of war.
Okay.
And so we also consider the general public interest.
Okay. So we are hoping that in the next 6 weeks thereabouts, or not before then anyway, the Nigerian government would have responded, dutifully to your demands, hoping that they will be acceded to. Well, we hope that will happen. Martin Egbanubi, thank you so much for talking to us at this time.